Even in high-income countries with established cervical cancer screening programs, there are important challenges in managing the growing number of women who are testing high-risk HPV positive. Colposcopy services are often resource-intensive, specialist-dependent, and increasingly overstretched. This leads to delays, variability in interpretation, and unnecessary referrals for many women. This device offers a novel and complementary approach for triaging HPV-positive women at the point of care. By combining high-quality cervical imaging with automated image analysis support, it can help standardize assessment and support clinical decision-making without relying solely on expert colposcopists. This has clear potential to improve efficiency, quality assurance, and consistency of care within organized screening programs.
NSV or Engine is an AI-driven smart colposcope, and it is designed to precisely detect cervical precancer or cancer long before the symptoms appear. The World Health Organization has recommended screening women with an HPV test, and NSV is a promising solution for triaging HPV-positive women at the point of care, particularly when combined with immediate treatment with thermal ablation.
It was trained with data from Zimbabwean women. This has made such a big difference in our triaging of women HPV positive. So I'm very, very excited about this tool, and I hope it's something that can be used in many more countries because it will make such a big difference.
This work also represents the first use of the device in the American context, which is an important step to ensure that the technology is appropriately calibrated to our local population, our clinical practices, and environmental conditions. Following this learning and calibration phase, we expect the algorithm to achieve a level of performance comparable to that observed in other settings. Compared with classic colposcopy, this approach is more portable and easier to scale, and it could be integrated into a wider range of clinical settings, including primary care and outpatient services. When combined with same-day treatment options, it may also support streamlined screen and treat pathways, reducing patient anxiety, loss to follow-up, and unnecessary procedures, which has far-reaching implications for populations with barriers to accessing care. That includes populations that are more rural or those residing within healthcare deserts. Overall, this technology has the potential to strengthen cervical cancer prevention, not only for low and middle income countries, but also in high income settings by improving efficiency, equity, and the quality of care for all women.
Artificial intelligence needs to be harnessed and wisely invested in order to increase the accuracy of cervical cancer screening, and so that it can be used by non-physicians such as nurses and other non-physicians. The workforce needs to be properly trained, not just once, but continually, to ensure that their skill levels are optimized. These are some of the areas that require massive and, as I said, wise investments for G7 partners in order for us to make the quantum leap from where we are now to cervical cancer elimination. Thank you.